bone marrow transplant is very similar to a blood transfusion. Basically, we take the bone marrow either from yourself or somebody else, and we try to purify it and take only the stem cells. The bone marrow is rich in stem cells, so we try to take those, and sometimes we even use the stem cells from the umbilical cords. But the idea is that we take those stem cells, we try to reproduce them when we have a big amount. A big amount might look like a syringe. It doesn't necessarily have to be like microscopically talking, we are looking for a good amount. But then you just put that into your bloodstream, and those cells will travel again and eventually will sit in the bone marrow again. So if we put those cells and the blood marrow is intact, then they will not find a place where to grow back again, because the blood marrow is there. Why to go there? So that's why we first do chemotherapy to basically remove all the bad bone marrow, and once it's empty, let's say that it's never really empty, but very, very diminished, then those cells will travel through the bloodstream and get there and start reproducing and regrowing. This is a process that sometimes takes 1, 2, 3 or more attempts, because the first transplant might not be successful and all of the cells just continue traveling through the bloodstream and never actually grow in the bone marrow. Some can do from the first attempt, and those are like the miracles and the ones that we really like to hear about. But unfortunately, some patients require more than one procedure to actually have a successful growth of stem cells in the bone marrow. But it is like a transplant. Actually, before, after getting the transplant, some patients receive a blood transfusion, because of course these cells need to travel in a liquid, and blood is very good, and because obviously the chemotherapy will create anemia and some other symptoms that they will need blood. So it is very common for you to see in a hospital a patient that has a very similar thing to a blood pack, but is maybe thinner and with not that much blood and a little darker. That might be the bone marrow. So it's very, very similar to a transfusion.